To hear the full episode, become a patron at patreon.com/deathpanelpod.
Welcome to the Death Panel. Patrons, thank you so much for supporting the show. None of the work that we do would be possible without you. To become a supporter of the show and get access to the second weekly bonus episode, as well as the entire back catalog of bonus episodes, become a patron at patreon.com/deathpanelpod. And to help us out some more, share the show with your friends, post about your favorite episodes, pick up copies of Health Communism, Counting Like a State, and Abolish Rent at your local bookstore, or request them at your local library, and follow us at deathpanel_. I'm Beatrice Adler-Bolton, and I'm joined today by two of my co-hosts, Artie Vierkant.
Hello.
And Phil Rocco.
Hey.
I'm glad to have OG panel back together to talk about
flavor.
Medicaid.
Yes, indeed.
Classico. And today, we're going to spend the episode talking about what's been happening with Medicaid over the last several months under the Trump administration. Since returning to office, the administration has made Medicaid once again a major focus of its broader effort to restructure the federal government's approach to public safety nets. Through a combination of different means, from legislation like the One Big Beautiful Bill to administrative rulemaking, new federal guidance, state waiver approvals, piece by piece, it's begun implementing a series of changes that will affect who qualifies for Medicaid, what people have to do to keep their coverage, how states will administer the program, who will get paid to set up new systems for each state, and how millions of people are essentially going to interact with the healthcare system is going to change as a result of this. So some of these changes have received a fair amount of attention. Work requirements have been back in the news, as have new reporting obligations and proposals around how essentially redeterminations are going to be done moving forward that basically make it easier for people to lose coverage if they fail to meet increasingly complex administrative requirements. Other changes, though, like the medical frailty exemption, I think have received much less attention. And essentially, each of these ways that the program is changed, while that decision can look incredibly technical, it often ends up having enormous consequences for how people actually experience healthcare. And that's why, we're going to spend a whole episode on this. First, we should step back and think about how to talk about exactly what is changing in Medicaid right now, because I think, certain listeners will have heard bits and pieces. Many of our listeners are going to be directly affected or are already being directly affected by these changes. But just to set up context here at the top, I think we should just sort of walk through big picture.
Yeah.
I mean, I think the most important context is that we are now about 1 year out from the passage of the One Big Beautiful Bill Act, which, the Trump administration has spent all this time spinning since then as the working families tax cut, so-called. The headline of which, as we talked about a lot last year, was essentially stripping some $1.2 trillion estimated out of Medicaid, funneling it towards things like ramping up ICE detention, ramping up ICE hiring, the very things that we've seen that many of us have been actively resisting throughout the U.S. over the last few months, that we've seen this kind of ongoing escalation of violence from the Trump administration, abetted in part by this increased funding pulled out of safety net healthcare spending. Additionally, we're, of course, in the middle of this, what the Trump administration has openly declared as its quote-unquote war on fraud.
This is the kind of corruption that shreds the fabric of a nation, and we are working on it like you wouldn't believe. So tonight, although started 4 months ago, I am officially announcing the war on fraud to be led by our great Vice President J.D. Vance.
But right now, my main focus, without any question, is to wage a war on fraud, waste, and abuse.
Okay.
Because that's what's required. All hands on deck. It's a massive issue. Hundreds of billions of dollars potentially out there. Not all of it's going to be collected at once. But we've got a war room right now focused very much on things that are going to really bother you.
And there's probably about $159 billion worth of fraud that has not been detected. And we are using AI to actually go out and detect that fraud and to end it.
Which I think addresses, in the Trump administration's parlance, a lot of different aspects. I think they kind of use this as their go-to lever, everything from elections, asserting that from Trump's original kind of shtick, right, of alleging election fraud, that the election was stolen from him, to things like we talked at length about again last year, Trump and his administration officials claiming that millions of dead people were claiming Social Security and it was, bankrupting the program, to, of course, baseless and racist claims about migrants fraudulently drawing welfare checks at a massive scale. And of course, as we're going to talk about today at some length, I'm sure, this alleging healthcare fraud, pulling, I think most recently, some like $1.2 billion in Medicaid funding from states, pulling or pausing rather, and Dr. Oz, the CMS administrator, going up and doing things like saying, we have a fraud war room, right, that's using tools like AI to guess basically where healthcare fraud is happening within the Medicaid system, and then penalize states, which just so happen to be states like, I don't know, Minnesota, where there was a huge amount of resistance against ICE deportations, Los Angeles, which in the very first year of Trump 2 had Waymos on fire and mass demonstrations and people, getting between ICE agents and the people that they were trying to target for state violence. No coincidence that California and Minnesota are the two states that they've chosen to first sort of target as the basis of this, quote unquote, there's healthcare fraud here, so says the AI program. But, so I think this is kind of the broader context. And then, of course, the main thing that we want to talk about, though, is this medical frailty redefinition that Bea talked about, which is going to kind of, I think, exacerbate the effects of the One Big Beautiful Bill Act even further than the $1.2 trillion that I already kind of talked about at the very beginning. But I think that's sort of what the field looks like at the moment.
Yeah, I guess the thing that's shocking to me, I don't know if it's shocking to you guys, like this is like what we're witnessing now, and possibly in ways that we're all completely underestimating. This is the largest sort of assault on a federal social program or a benefit, and the largest reduction in benefits at one time as has like ever existed in the history of Medicare, Medicaid, and Social Security. The sort of the main, arteries of like what counts as the sort of formal government delivered welfare state in the United States. And like, it's nowhere to be found really in like the headlines. I watched like a gubernatorial debate this week, and there wasn't a single question even about like healthcare, despite the fact that like the numbers on this, even like the most conservative estimates of what these rules are like going to do are like staggering.
Oh, but and Phil, the reflecting pool.
Right.
Sorry.
But, it's and I guess I should pause everything that I'm going to say because we're waiting for the Senate Budget Committee's hearing next week, which is called Medicaid: the reality. So I should grain of salt everything I'm saying. But the
Medicaid, the movie, the ride. Yeah.
But the thing that is striking to me, like on the one hand, you have people saying, well, Republicans have never really succeeded in truly going after these programs. They've never been able to pass. They've never been able to like do the Paul Ryan wet dream of like, Medicaid block grants, so that he evidently a dream he had while in college doing keg stands. And they've never been able to like really like retrench these programs in like these serious kind of ways that people began dreaming up in the early 1990s. And I think that part of the reason why that might have been true in the past is all of the sort of like what Peter Germanis and Stuart Butler at the Heritage Foundation called like the Leninist strategy for gutting these programs was always like kind of like too clever by half in the sense that like they were like, oh, we're going to like create these like private alternatives and like people will see that the private alternatives are like better. And like that's our like long term, like 20 to 30 year plan for getting rid of the paltry American welfare state. Right. And instead, the sort of like the political formula that is far, less clever looking, but I think far more like effective is to just assert that all manner of things that are just involved in getting a benefit or delivering it are just fraud. Right. Mm-hmm. We're just going to call them fraud. And because the program's so fucking complex, no one will know what that means. And it'll be very easy to sort of make this case. And there's a variety of things we can get into, like why I think it's easier to do waste, fraud, and abuse argument with Medicaid. But like the reality is it's not like reducing support for the idea that like government should be giving people these benefits. Like that's, as strong as it ever was. And like support for even like universalism is growing stronger, I think, because people see the sort of results of this. But it is helping to animate this idea that not only is there this thing that we're calling fraud, which again is an absolutely nebulous category, which now can be applied to basically anything. And we'll get into the frailty discussion is I think going to allow them to expand the sweep of that net in actually sort of unprecedented ways. But the other thing that they're going to be able to do, and I think that they're already doing, is in just sort of like using all of the kind of sort of apparatus of this program to begin looking at what they're doing is like you would think that the program existed not to like provide healthcare benefits, but instead to police fraud. By doing that, you just sort of gradually get the experts and the sort of like all of the mediators of this stuff fixated on this idea: fraud, does it exist? How bad is it? Et cetera, et cetera. And you begin to like shift where the boundaries are in like the war of position over healthcare itself. So that we're now like, again, continuously fighting on the battleground of like 2009, 2010 Affordable Care Act kind of shit. But like, that's why the thing that annoys me is like because of the nature of what they're doing is so like technical and wonky, as you said, like it then becomes dominated by wonk shit and wonk speak. And this sort of the broader political history of like, this is part of a, several generation plan to just, end these programs or make them, and the logic being making them so stingy, so difficult to get, and essentially criminalizing the receipt of any benefit that you whittle down whatever support coalition exists for them, and you make even their strongest defenders begin to kind of see the logic of like doing away with them. So yeah, I'm eager to get into the details, not because the details themselves are the kind of important things, but because they are the expression of, I think, this larger kind of like war of position that has been happening for like, again, I think 20 to 30 years.
Absolutely. I mean, you took the words right out of my mouth, Phil. I think, as we're going to get into, like, one of the biggest challenges whenever you're talking about what's happening to Medicaid is that it's so easy to get lost in the details, right? Like, every change to Medicaid involves so many different moving pieces, and those details like matter enormously. But the problem is that while each of those details are important, right? Like, what's really dangerous is that it's easy to become so focused on like those individual, sort of technical changes and how those pieces fit together and lose sight of the larger transformation that's taking place, right? Like, you talk about each tree without like stepping back to see the forest. And I think that this is like the problem that we see with a lot of, health policy researchers or people who are like asked to comment for the media, or the kind of way that this is being interpreted through like kind of popular conversations is like, that the biggest story is the work requirements. And I think that is a huge part of it, right? Like, and that's a very much more easy to understand sort of like framework for people, right? And I think it's also easy to say, oh, well, this, they haven't been successful before, so hopefully we're going to be, fighting this through in the courts and it'll all turn out fine. But, I don't actually think that the biggest story is the work requirements. I think it's this medical frailty exemption. We can easily miss this much more significant political development that is like changing the very point of Medicaid, like textually changing the point of Medicaid through what seems like just a shift in like the definition of medical frailty actually just completely redefines like what the point of Medicaid is. And this has been something that has been contested like since the day that Medicaid was proposed. Right. And, I think that there's a much bigger claim that we're trying to make today, that the administration is essentially not just like making cuts or making enrollment more difficult, but that we are watching the federal government change the fundamental organizing principle and logic of the program itself. Right. Yeah. Like, historically, whatever else Medicaid has also been, it's operated around one very basic assumption, which is that there are people whose health depends on continuous access to medical care, and that the public has some obligation, like however limited, stingy, uneven, or punishing, to ensure that continuity exists, right? Medicaid has never anything close to universal health care. It's not equitable. It was never sufficient. But embedded within the program was a recognition that there are groups of people for whom interruptions in care produce suffering, disability, financial catastrophe, death, right? And that the architecture of the program was built around trying, again, incredibly imperfectly, but trying to keep those interruptions from happening, right? And that's why this medical frailty exemption, is such a big deal, right? Because the point is not sort of like who is or isn't in that category, right? But the point is like in the way that they're changing the medical frailty category, which we're going to get into in a little bit, they're essentially saying that the issue is really not if there is a group of people who require this kind of continuity of care, but, are there people who can sort of demonstrate that they deserve that care because they can or cannot work, right? And so we're seeing essentially like a benefit that was organized around the baseline principle of like, we have to make sure that certain groups of people, like children, pregnant people, elders, disabled people, people with conditions that, like cancer, if their treatment was interrupted, it would be like seriously a problem, right? So we need to exempt them from the more draconian sort of punishing cycles of redetermination that's a part of Medicaid. And that's really what the medical frailty exemption was. What it is now is tied into the concept and theory of the work requirements. And that's taking Medicaid out of the landscape of being a program that makes sure that populations that need that continuous care have some sort of like baseline, right? And instead it's setting this new threshold of saying, Medicaid is about punishing the poor, as we know, but Medicaid is about sort of a broader lens on labor, work determination, and surveillance of the poor. And that concept of like continuous care is being totally dropped out of Medicaid from like a very textual standpoint.
To hear the full episode, become a patron at patreon.com/deathpanelpod.